Great to have you with us. So I'm Jo Stanford. I head up the Healthcare Project and Change Association, and I'm delighted to have James Freed with us today, who's going to do the session for us on the NHS Digital Academy and how to develop those skills for project professionals. So I hope that's what you all come along for today. These are always fantastic opportunities to network, connect, get to know each other. So please do introduce yourselves in the chat. So those of you that turned up on time, if you can get the ball rolling, introduce yourself, who you are, where you work and what you do. It's always great to look out for colleagues and peers in the room. So please do have a look at the chat and add yourself to it and connect with each other. I'm just going to do a little bit of an intro on HPCA and just give you a quick update on what's coming up for us in the association. If anybody hasn't subscribed to HPCA and you've just signed up for this event, please do join up. It is free to subscribe for anybody to be part of it, and we've got some great events coming up, open to everybody to be a part of. So please do sign up if you haven't already. So for anybody who's new to HPCA, we are a not-for-profit community interest company supporting not just project and change professionals in the healthcare sector in the UK, but also supporting everybody in the healthcare workforce with project and change skills. So whatever your professional background, there's something to help you develop project and change skills. We work really collaboratively with the other professional associations and look to develop the professional bodies and the workforce as a whole. We have regional networks in each of the regions in England and also Wales, Scotland and Northern Ireland. We have a series of professional development events going on at the moment. The first one you can watch on demand if you missed it, and these are with the Association for Project Management, and it's really about how to develop your project professional career. The next one is actually tomorrow, so if you haven't signed up for it already but you're interested, please do. This is the second in the series, so this is people in the sort of middle development of their careers, looking at career progression. And we've got a fantastic speaker in Rochelle Sampson-Clark coming to tell us her experience and to share that with you and give you some insights on how you can help to progress your career. The third event that we have with the APM is on the 4th of June, and that's for those that are looking to become chartered, to really get to the top of the profession. So come along and hear from Helen Doherty, who's from NHS Business Services Authority, who's been down that road, as well as myself, and find out what you can do to become a high-level professional and chartered with the Association for Project Management. Additionally, we have a lot of community webinars and events coming up, and as well as the APM ones, we've been doing some collaboration with the Federation for Informatics Professionals and with AFA, so the data analysts. So if you're interested, you don't have to have a background in this, but there's something of value for everybody to learn more about digital and data projects. Come and sign up for these. I won't go through them all. But then we have also a series of events that we're doing around case studies for collaboration for service improvement. So our first one is in September, and that's on a case study of non-surgical oncology joint service with the fabulous Jules Houle, who's going to come and talk about how they've used change management to create a culture in a new team coming together from two different organisations. So do sign up for those. Regionally, we have some events coming up. First one is this Friday in London. You can sign up for any of them, but it's a great opportunity to meet people in your regional area and make connections with others working in that space. Absolutely delighted to see the first Wales community event is on the 24th of June. So please do sign up for that if you're from Wales and you're not already connected in with the community. And lastly, there's just a little bit about the training courses that we provide. So we do obviously around project management with the APM, but also we do a lot around change management, and that's around the people side of change. And this is a really big area within the healthcare sector and something we could all, I think, improve on. So there's lots of resources and support around change management. We've got free online learning. And Helen will drop that link in the chat if you haven't already seen our free online learning modules. And then we have a series of sort of level 2 courses. These are our essentials courses covering the kind of key components. So project management, benefits management, change management, risk management, and SRO essentials. So if you have SROs in your organization that haven't had the opportunity to have any training, please do send them our way. And then finally, we've got organizational membership. Having a group of professionals with really great skills is important, but if the organisation isn't developing its maturity, then it's a real opportunity to support the organisation to develop. And there's a timer on there I haven't switched off. But anyway, I'll stop there and we'll tell you maybe a little bit more about the government membership next time. But without further ado, I would love to introduce you to James Freed. So James is the Deputy Director of the NHS Digital Academy at NHS England. We've worked together previously. He's a fantastic guy, and I'm delighted he's given us his time today to tell you all about the Digital Academy and how you can access the resources in there to support you and your teams to develop digital and data skills. Thanks for joining us today, James. Great to have you with us.
Oh, thank you very much, Joe. What a lovely introduction. And it's been a great pleasure working with you over the years too, I might add. Tremendous. Thank you very much. It's a tremendous honour, tremendous a pleasure to talk to you all today. I normally find myself talking to two different groups. So the first group is people who are digital and data professionals. The second is senior leaders. So I think this is the first time I'm talking to a sort of a dedicated project program change management professional audience, and I'm really interested to see and hear how this sort of content lands. I'm going to be using a Menti. So if you've got a personal device, you can take a picture of a QR code in a minute and sign up to it, or Helen's very helpfully popped the link into the chat. But before I went on to my slides, I thought I'd tell you a little bit about me and why I'm doing this. So I started off as a scientist, thought I was going to cure cancer. I didn't cure cancer, but I went into change management and cancer services. So I worked in hospitals in southwest London, trying to do a lot of process mapping and process redesign around how to make cancer services better for patients, but also better for the clinicians and support staff delivering those services. I learned a lot about how not to do change management, I have to say, and it's also the place where my love of digital and passion to make more out of the digital investments that we provide was born. I saw this was in the year 2000. I saw 1980s technology, green screens. I saw great big piles of paper. I saw poor governance processes with how digital was used. I saw a lack of understanding about how those technologies should be used or could be used. I saw the law being breached, particularly when it came to information governance. And I remember saying to my boss, oh, I wish there was just some sort of national program for IT. And she suggested I looked in the HSJ, and I joined what became known as the National Program for IT. I went and worked for them for a few years. Then I spent some time in public health, but also in digital. And then I became Health Education England's first Chief Information Officer a decade ago, which is where I met Joe. And now I'm spending my time doing the things that I think are most impactful, which is working on digital skills. What I wanted to do is, and the purpose of me being here, is explaining a little bit about the knowledge and evidence research that we've accrued and we have found, we've uncovered and stitched it together into a bit of a story. I want to tell that story. And I want to tell that story because I think that the tenets of it, the lessons that that story has to show us, I think are as applicable to project program and change management professionals as they are to digital professionals. But like I say, I'd be really interested in hearing your views on how this lands. So with no further ado, let me share my slides. Joe, can you see? Are we all good?
Yes, all good. That's great, James.
Smashing. Thank you very much. So that's me. Do feel free to get in contact with me. That's my X handle, and my email address is both in the chat that I shared my details on earlier on the Teams call, but also it'll be on the very last slide. Please do join the Menti now, either using the QR code or the menti.com link through a browser on your machine or in your handheld device. There'll be 2 or 3 questions that I'll ask along the way, but it's an opportunity for you to see what everyone else thinks, and it's also an opportunity for me to gather some data. It's entirely anonymous, so please be honest. Okay, so I tend to start these talks by talking about some of the biggest problems in the NHS and the difficulties that we face. But before I get there, I've got a couple of questions for you. The first is, I'd like you to estimate, please, the proportion of change, so between 0 and 100%, the proportion of change in the NHS that's underpinned in some way by digital and data. This will help me get an idea about how much you see digital and data contributing to your role as change managers, project and program management professionals. And in a minute, I will let you compare your results to the results I normally get when I go to a digital heavy audience. The problem, of course, of using Menti is it takes a little bit of time to feed in responses. I think I saw about 80 or so people on the call. So I'm going to wait until this, well, I'm going to wait another maybe 20 seconds. And then I will show you the graph of digital professionals in a second, or digital professional responses in a second. You can tell when people have filled in because you start getting thumbs up icons. That was me. Thank you very much. Right, last 5 seconds. So we have got an upper range of 100% of change underpinned by digital down to a bottom level of about the 25%. It's a broad range, isn't it? Let me show you what digital professionals say. See, do I have that? Oh no. I've taken that slide out. They said, let me go back to this one because I'll show it you on the same graph. It's very, very similar, but actually some digital professionals go down as low as 5%. There are still a few that are up in the 100%, but it tends to average out at about the 60 mark. Between 60 and 80% is what people are guessing. So what I would say is, from this distribution, you are not fundamentally different to those people who work with digital on a very day-to-day basis in terms of your estimate of the amount of change that's underpinned by digital in the NHS. And the reason why this happens is because the opportunity that digital technologies and data provide to us is increasing. This graph is something called Moore's law. It demonstrates the rate of change in the power of computer processors over time. Each dot is measuring the number of transistors on a typical, or components, I suppose, on a typical computer chip of about the same size, about the same cost as it goes along in time. And as you can see, it's a fairly straight line. Now, what you might not immediately see is that there is a logarithmic scale here. So it goes from 1,000 to 10,000 to 100,000 to 1,000,000. When you see a straight line on a logarithmic graph, that's a true, what's known as an exponential change, a doubling over time. And it's the reason why it's called Moore's law. It was coined by a guy called Gordon Moore. He went on to develop the company Intel, which dominated the computer chip market for a very long time. Not at the moment, I might add, but it did do for a long time. Moore's law is still alive today. There is still a doubling of basically the processing power, the opportunity that digital technologies can give us every 2 years. That means that if you think of since before computers were around up until today, all of that change that you've seen that computers and computer programs and digital technologies provide to us on our day-to-day basis, online shopping, how we interact with one another, how socializing has changed because of digital technologies, all of those things all together, all of that change will double in the next 2 years. By 2027, we'll see all of that again in terms of opportunity. I was just looking this morning actually on a YouTube video on robotics, and if you want to be simultaneously excited and deeply, deeply terrified, Google robotics, or look on YouTube for a video about modern advances in robotics. It is deeply scary, but also tremendously exciting. So this is the reason, this is the law that underpins the opportunity of change in the digital world. Let me ask you another question. All right. So given there's this massive opportunity, how well do you think all of those digital technologies work for NHS staff? So if you were to go and ask colleagues working in the NHS, whether it's a hospital or GP surgery or community care, wherever you think, how do you think they would rate their experience of technologies in their day-to-day job, not at home, but at work, out of 10? Now, obviously, this is different from asking them directly, but I'm asking you your view, and I'm going to tell you what they said in a minute. Right, we had about 50 responses, I think, last time, so I want to get up to at least 50. Come on, we're on 47. We can do it. 48. 49. One more. Fantastic. Right. Okay. I'm going to move on then. Thank you very much. All right. So we're seeing a peak of 18 of you have said, I think that should be 4 out of 10 there. 10 have gone 5 out of 10. So it's a normal distribution, but it's around the 4. Oh, tell you what, you don't think that it's a great experience, do you? In actual fact, NHS staff, on average, rated their experience of the quality of technology used at work as 6 out of 10. It did vary a little bit, depending on which professional group. So if you're a digital member of staff, it was slightly higher, it was about a 7. If you're a scientist, it was slightly lower, it was about 5 out of 10. You're not a million miles off, but you're a little bit more pessimistic than you need to be. I should say, however, that digital professionals rate it about the same. It's about 4 out of 10 on average for digital professionals. So again, your view is very comparable to that of digital data and technology professionals in the NHS. 6 out of 10 isn't bad. But it is a detractor score, a net detractor score. That means people are more likely to talk negatively about their experience of technologies at work than positively. And what this means to me is that there's a bit of a mismatch. You know, on one hand, we talk about the opportunity of technology being absolutely phenomenal. We can do all sorts of things that we never could do before. And on the other hand, people saying, well, where is it then? Where is it at work? Because it ain't at my work. And why is that? So that's fundamentally the question I want to try and answer in this next section. Why are digital technologies not meeting the promises that they're making? Why are they not meeting people's needs? Right, so firstly, change initiatives when it comes to digital fail more often than they succeed. Here are 3 different stats that are very similar from 3 different very reputable organizations, Forbes, the Harvard Business Review, and McKinsey, all of whom did separate studies looking at the success rate of digital initiatives across all industries, across all countries. Success in this definition, or rather failure, I suppose, in this definition, is the digital initiatives that did not meet all of the benefits they were expected to meet. If we look at that in a little bit more detail, this is the data I like the most. So it's some data from Boston Consulting Group, looking at almost 900 different digital transformations. And what they did is they looked at the proportion of benefits that were met at the point at which the initiative concluded, so the implementation concluded. And 70% of those, again, very similar score, were in either this woe or worry category, didn't meet all of the ambitions, all of the benefits, all of the targets that they were aiming to undertake, with limited long-term change. What's more worrying is that a quarter, 26% of those digital initiatives met fewer than half of the benefits, half of the targets that they were aiming to meet, and had no sustainable change at all. Now, that I think we can all agree is a definite failure. A 1 in 4 definite failure rate, 3 in 4, almost 3 in 4 significant failure rate, a limited long-term change, is not a great return on investment. So let's look into a little bit about why that might be. So firstly, I'm going to draw on some data from a company called Gartner. They do a lot of tech analysis and they provide a lot of guidance for senior digital leaders. One of the pieces of work they did was looking at failure rate of digital initiatives in government. So now we're narrowing it down from all industries, all worlds, all countries, sorry, to just those digital initiatives, digital transformation initiatives undertaken in public sector bodies. And what they found out was that although 1 in 5 of those digital initiatives will fail for budgetary reasons, about 1 in 5 of them will fail for technology reasons. Fully 3 in 5, about 63% of them, fail either for cultural reasons or skills deficit reasons. So things we could potentially address through education programs. Most digital initiatives fail, and most digital failures occur because of education gaps. Now, intrinsically, our staff know that. Back in 2019, we did something called the Topple Review. We looked at what the learning needs of the NHS workforce is likely to be based on the changes in technology over time. We made a bunch of predictions, one of which was that in the future, 90% of NHS staff are going to need digital skills in order to do their job. Right now, barely 5 years after the Topple Review was published, our own staff think that that stat is higher. 98% of respondents from all walks of NHS life, senior, junior, digital, non-digital, clinical, non-clinical, 98% of them strongly agreed that their digital skills will need to be developed over the next 5 years and will be important for their job in that same period of time. I'm going to go really specific now. I'm going to look at NHS data. So this slide it requires some explanation. So each one of these grey lines, you can see it's long, but in the negative axis here, it's long, but in the positive axis here, they're in order. Each one of these grey lines is a different hospital in the NHS. The length of this line shows the satisfaction of staff within that organisation with one piece of technology. It's a very pervasive piece of technology. It's called the electronic patient record, or if you're American, the electronic health record. That's what EHR means here. In 2024, there was a very in-depth survey. 23,000 people in the NHS responded to it. There was a whole bunch of very, very detailed questions about their experience of the electronic patient record and what it was, why it was, and what its impact was on that individual. This is I suppose it's the money slide. This is the big summary of all of those different experience measures added up per site. So this one at the bottom is an organisation that scores, well, there's one actually, it scores about -50. So anything that's minus is a net negative experience score. People would rather not have the electronic patient record than have it. People who score positively, or organisations that score positively, are staffed by people who think that it's more beneficial than not being there. Basically, it's greater than a meh response. 0 is very much the meh response of it being right on the cusp of adding value or causing harm. In general, in the NHS, we don't do super well. I'll tell you about that in a second. But what I wanted to lead with is how these organisations are linked. Now, we spend quite a lot of time in the digital world talking about digital technologies, and I've just shown you a slide that says actually only 1/5 of digital transformations fail because of the technologies. Now, most of you will have looked at that, many of you will have looked at that and thought, yeah, okay. Nonetheless, if I'm going to be doing a change that involves a piece of kit, I'm going to be looking at that digital piece of kit a lot and working out whether it works or not, whether it's usable, does it have the right functionality, because clearly that's one of the most important things, if not the most important thing. Now, these coloured bars here, the different colours, they join sites that have got exactly the same electronic patient record. It's the same system. And what I would encourage you to, the conclusion I'd encourage you to draw from this is that because these things are mostly so wide, the contribution of the product, the digital product, to the staff members' experience of that product is much less than you might otherwise anticipate, which must mean there are other things that aren't the product that contribute much more to whether I, as a member of staff, enjoy using this digital product or not. I hope that makes sense. So with a couple of outliers, this one down here, which clearly all of the sites had a very poor experience, and this product up here, where all of the sites had a very good experience. There's a really wide range of different sites who've employed the same product but got very different outcomes. So what I'm saying here is that your job, the change manager's job, the project and program manager's job, is really important when it comes to implementing a digital product, because your work, more than the choice of a product, is going to have an impact on how people are able to use that. And let me also point out that this is not just about people being happy. There's a really good JAMA paper. It's a digital health informatics journal from the States that correlates staff satisfaction with electronic patient records to patient safety. If people are happier at work in using digital products, their patients are more likely to survive and more likely to get better health outcomes. So this really, 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 really does matter. In general, the UK isn't great at implementing electronic patient records. My hypothesis would be, in general, the UK isn't great at implementing digital technologies in healthcare. The net result for the entirety of the NHS in 2021 was 3.4, barely a positive score. The net result in 2024, last year, was 5.1. Again, barely that much better. All of the rest of grey is all of the other healthcare systems across the rest of the world. It's a tremendously rich data set, this, but it does demonstrate that the NHS could do a lot more in implementing digital technologies better. So where do we not perform super well? So one of the great things about being part of this Arch Collaborative, developed by an organisation called Class, I can't remember what it stands for. It's the initials of the 4 founders, but they're a consultancy company. They've set up this Arch Collaborative as an entirely voluntary, free-to-enter way of using the same survey with staff, so you can compare and contrast user-centeredness, usability, and user satisfaction of electronic patient record implementation wherever you are in the world. Anything red means we're in the bottom quartile. Bottom quartile globally is this first column, and the bottom quartile comparing only against non-US health systems. So in some ways, they're more comparable. But our stats are here, and you can see the numbers are high. These are the 23,000 people who've responded. We're not great for any of these, whether our systems are reliable, fast response time, whether it's got the functionality, whether it's easy to learn, whether it enables patient safety, whether it enables quality care. And some of these things are not to do with the product themselves. So I guess the case I'm making is digital failures are common. Digital failures are more to do with people and culture and education than they are to do with technology. And digital failures are really important because they're tremendously impactful. The first impact is cost. We estimate very conservatively that we waste about £370 million every year in the NHS, just through the bottom 26% of digital implementations. This number is absolutely not pie in the sky. Just looking at electronic patient record data, if we look at the estimate in terms of lost productivity caused from unproductive charting, is what it's known as, using charts in an unproductive way, that's estimated as £1.5 billion a year in the NHS in England. These are not small figures, and this is about us implementing digital technologies well. Also, as well as creating productivity issues and losing potentially money, there are also other disbenefits, including harm. I want to show you some of the work that we did as part of our learning needs analysis. At the beginning of last year, it's published, by the way. If you're interested in having a look, you can see what NHS staff feel they need to know in terms of digital skills. But basically what they've been telling us is that they don't feel they've got the confidence or in some cases competence in use of the digital technologies they've been asked to use, that the technologies they're being asked to use are either unusable, being ineffective tech, or not meeting users' needs, or unavailable. A lot of people are telling us they just don't have access to technologies, or in some cases, the training that they need in order to use those technologies. Now, if people are unable to use technologies well, the data within those technologies is going to be poor. And if that data is poor, the decision making that's been undertaken based on that data is also going to be poor. And we are making big decisions worth lots and lots of money and lots of lives on that poor quality data at the moment, on the data that's in those electronic patient records that have got poor user satisfaction. Let me give you one other actually really quite scary stat. There's a strong correlation between burnout of staff and the satisfaction those staff have with their electronic patient record. The organisations that scored the worst for satisfaction of their EPR had more than twice the burnout rate that those than organisations that had the best staff satisfaction for EPR in. Now, that's a correlation, not a causation. There are lots of other factors there that are synergistic. So poorly run organisations might have poor staffing and might also have had a poorly implemented electronic patient record. So these things correlate. They don't necessarily cause. But I just wanted to show you this because there is a net impact and that there is a strong correlation between staff burnout and staff EPR experience. So it matters. Getting digital right, making that change management process right matters. And now what I'm going to tell you is who needs to behave differently. I hope this is helpful because some of you will be running change programs that involve digital technologies. And I think the work that we've done, it certainly helps me think about how I might manage a digitally mediated change and who I need to support and how I need to support them. Firstly, let's look at the whole workforce. In many cases, digital technologies will require end users, people in the NHS, to use. There's some really good data now from a charity called Future.now and Lloyds Bank, who conduct and have done for the last 7 years a Consumer Digital Index review. They interview about 5,000 people through Ipsos Mori every single year and ask them where they stand on their essential digital skills. They measure against the government's essential digital skills framework, and what they have demonstrated is that although there is a correlation between the proportion of essential digital skills that one might have and things like age or academic achievement or salary, the strongest correlation is between that digital literacy rating and the industry in which you work. And in fact, this little medical slice here, which actually when they say medical, they really mean health and care, is not performing that well. On average, if you work in the NHS, you are less digitally literate than the patients you are serving. Only 37% of us have all of the government suggested essential digital skills for work. These are basic skills. They're things like, can I access my payslip online? Do I know what the little lock in the corner of a browser window means? And more importantly, I suppose, what it means if it's not there. Which means that there is a proportion of people, 63%, that do not have all. In fact, if I look outside of this, there are 15% of people who've got fewer than 5 of those essential digital skills for work. Probably about 5%, about 1 in 20 of the NHS workforce who've got none whatsoever. Those are the sorts of people who may find it difficult to use a computer at all, including to learn. So if you're delivering training programs or change adoption methodologies or approaches or training videos through the medium of a computer, you are likely to be excluding about 1 in 20 of the people who you're trying to reach. We know that relatively small amounts of training makes a massive difference. If we go back to the electronic patient record example, this is NHS stats again. If firstly, about a third of the people who responded, 7,000, said that they didn't get any training in a typical year for their electronic patient record, and they had a net negative score on that electronic patient record experience rating, -4. If you have at least 1 hour a year, that jumps to 13. There's a 17-point difference there just by having 1 hour a year in terms of delivery. The good news here is that it doesn't really matter around the method of delivery either. Although online learning might exclude some, as an audience as a whole, they do not gain any more from face-to-face training than they do for online. That doesn't mean you shouldn't do face-to-face. Obviously, you should be delivering face-to-face training to those people who can't use computers, or even better, teaching them how to use computers in the first place. But a very small amount of training can make quite a large difference in terms of a staff member's satisfaction with the digital technologies that they're trying to or being asked to use. There's also an issue in that more and more people who work in organisations are turning to technologies to improve the way in which they run their own services. This is data from outside of the NHS now, but in 2020 there was a tipping point where there were suddenly more people who are what we might call business technologists bringing technologies from outside work into work to use to improve their own productivity and their own teams working than people who weren't, than just general end users. And that most of these people are not corporate IT or digital professionals. They're just workers. They may sometimes be leading teams. They may sometimes be project managers, but they're not formal digital data and technology professionals in the most part. We saw this in the NHS in COVID when suddenly people started using WhatsApp. It introduced some risks, but it also addressed some risks. And that's why, and because technology moved on, Moore's Law, going right back to one of my first slides, these technologies became much more pervasive, much more consumer accessible. So people could start applying those consumer technologies in work effectively, quickly. I was going to say safely, but that's debatable. I'm also going to talk about a third group of people, and that is digital data and technology professionals. I suspect some of you on the call, as well as being change professionals, will also be digital professionals. Now, relatively recently, we are establishing common families of roles. Until recently, in fact, very recently, of the 43,000 people who are digital data or technology professionals in the NHS, there were a vast profusion of job titles, about 19,000 job titles for those 43,000 professionals. That's on average one job title for every two people, and that is unsustainable, that sort of level of diversity and spread, because as soon as there's variation in those sorts of job titles, the capability frameworks that underpin them, it becomes really difficult to source education at scale. So the Federation of Informatics Professionals, FedIP, started to put some structure around it. They borrowed structures from central government. That's what GDAD stands for, Government, Digital and Data. And they created some NHS-specific additional families, which although some of them aren't NHS specific, cybersecurity, information governance, for instance, are not specific to the NHS, but they weren't part of the original government digital and data families. And they started to flesh out roles and capabilities underneath them. I know that Joe has been working very closely with FedIP and looking at the overlaps and the and how we fundamentally support the NHS workforce. There's one role I wanted to pick out in particular. You might not be able to see it on my slide, but over here it says delivery manager. In the digital world, delivery manager and product manager are almost synonymous. And over the next 6 months, the NHS Digital Academy will be working to develop some online training resources to support delivery managers and product managers in the NHS. So do keep an eye on our website, and if you are interested, our newsletter. So I just wanted to draw that all together. So I started off this section by saying, I'm going to tell you the different groups of people who need to know those different things. Fundamentally, our job as the Digital Academy is to try and help as many NHS services deliver more value more quickly through access to the right skills, data and technologies. Many of those services will be delivering more value through change programs. In fact, all of them will be delivering more value through change programs. That's how you deliver more value, through some sort of change, which means it'll need to be managed in some way. Now, we've found that the reason why it doesn't work, the reason why NHS services don't deliver more value, despite the changes they try and implement, basically falls down to two issues. The first one is our staff say they can't use the technologies we ask them to use. And the second is the technologies we ask them to use are either unusable or unavailable. Now, there are different groups of people we're trying to communicate with and educate to address that. The first, and we think most impactful, is around trying to help people use the technologies they've got, regardless of the quality of those technologies. I think I've shown you the data to demonstrate that even when you take exactly the same product and you apply a small amount of training, you can make a big difference in terms of user satisfaction and therefore end outcomes like how well a product is used and patient outcomes. So a lot of our effort this year is going to be spent in supporting the tools and techniques to support not just frontline NHS staff use the technologies they've got at the moment, but also work with educators who are based in local NHS organisations to help them be as effective as possible. It's slightly harder to try and address the second issue. How do you make digital technologies that are both usable and available, given how complex that is? The first area is supporting digital data and technology professionals, that career structure that we mentioned before, and the work that we're doing at the moment in trying to consolidate and develop those education products and make them available is our first step. The second piece is to support the 50% of people working in the NHS who are bringing in new technologies but are not digital and data and technology professionals. We don't yet have much education in this space, but it is very much one of the things that we want to develop. And then finally, senior leaders can create an environment for all of this stuff to work or indeed to fail in an organisation. We already have products aimed at boards. We've got the digital boards program provided by NHS providers. If you're in a position to influence your board, please do convince them to try and book a session. It is free at point of delivery. And also education products for our most senior digital leaders, in particular the Digital Health Leadership Programme, which we're hoping to launch at the end of next week, cohort 8 of. And if you're interested, please do have a look again at our website or our newsletter. So just to finish off, how are we helping? So this is what we do. We research, design, deliver education products and deliver them to you at wherever possible in a free way. We have got a fairly broad selection of products at the moment, going from our digital literacy self-assessment tool through to the board development programs. We've got things like AI awareness models and specific modules about user-centered design, which are undergoing a refresh at the moment. We also financially support a group of organisations called the Digital Skills Development Networks. There's at least one for every region, 2 in the Northeast. And if you or your teams are looking for specialist digital skills, they provide many, in fact, more than 100 different courses, supported the development of over, I think, 2,000 digital professionals last year. And they're the cheapest way to access digital training. Do look at them if you can. If you're unsure about how to find your local digital skills development network, contact us and we'll put you in contact. This year, we're going to concentrate on a number of things, and I want to tell you about 4 of them. So firstly, our Digital Health Leadership Programme Cohort 8, which will launch either next week or the week after, it's going to concentrate on supporting the optimisation of electronic patient records. We know that England can make a big jump in this area, and we want to try and support that jump. Secondly, we're revisiting our digital self-assessment tool, led by one of my team, Tina Johnson, who is undertaking some work at the moment to redevelop that and improve that tool. And we are supporting general digital data confidence and competence improving services and products later in the year. Thirdly, we're going to be developing a signposting offer. We know that there's a huge amount of education out there and it can be quite confusing. So providing the sort of the Digital Academy trusted seal of approval, we think is going to make a big difference in cutting through some of that difficulty. And finally, I've mentioned it a couple of times, a more comprehensive digital data and technology professional offer, starting with that delivery management and product management piece. We're here to train the NHS to do digital better. I'll be really interested in your questions in a minute, but and I'm going to take this down in a second to do some Q&A, but I will leave the question live. I'd be really interested in hearing what digital skills development you feel you need, but importantly, and why. So I guess the difference between a learning needs analysis and a learning questionnaire is working out what the underlying need is that people have and meeting it, as opposed to just asking for their wants when we get lots of Excel training requests. So if you could fill that in, that'd be fantastic. I won't show this on screen. I will stop sharing, and then when you get the slides, you'll see there is a sign up QR code for our newsletter that you can click on. Maybe we can put that up right at the end, Joe, if that's okay with you. But right now, that's me. Thank you very much for your time.
Thank you, James. That's fantastic. Some quite startling insights, I think, in terms of the health sector as well as data and the outcomes and where they aren't in terms of the money and time and effort invested, and yet we're not seeing the outcomes delivered. I think I, like many people, feel like I'm on the back foot when it comes to digital skills, and I think I have a slight concern that with the financial challenges that most NHS, in fact all NHS organisations are facing, skills development, training and development, invest in staff development seems to be a bit of an easy win for organisations to cut. And
Yeah.
that concerns me when we've got the need to keep upskilling the workforce. We've put the links to the digital skills development networks and also to the Digital Academy in the chat, FedIP, the EPR support hub, the frontline digitalisation team. Where do you suggest people go first to look at, well, what can I do to assess what skills they've got and where those gaps are? You mentioned those kind of core capabilities. Is there an assessment people can do?
There is. So there's a digital self-assessment tool. I think Tina might be on, so we might be able to find that link
Yes.
in a minute.
Tina, if you're there, can you stick the link in the chat?
If not, I'll do it in a second or maybe shortly after we finish. But and I would suggest people go there first. It's based on a capability framework we developed back in 2017, which is the skills required to live, thrive, and survive, basically. So it's not just work-based; it's also home-based skills. It's based on a framework that was initially developed by JISC, and it's basically the grandmother of the digital capability frameworks used in healthcare. It's not the only one. There are 58, but most of the others are developed based on ours, and I would go there first. The self-assessment tool is a good way to, you were asked a bunch of questions and it will it will tell you where you've got your deficits and where you've got your strengths, and then it will point you through to some learning resources that will help you address it. It's free for anyone within well, actually, I think it's free with anyone with a UK IP address and a Learning Hub or DLS, Digital Learning Solutions log on. But it should be open to everyone on this chat.
So the Digital Learning Solutions log on, is that linked to then those regional groups?
No, so that's part of the NHS England Technology Enhanced Learning offer.
Okay.
So it's just that at the moment there are different platforms for different things. So one of them is called Digital Learning Solutions, and that happens to be where our digital self-assessment tool is placed.
Okay, fantastic.
At the end of the year, you won't need to know all of those different things. There'll be one. There's something called Project Fusion, which is bringing them all together. But at the moment, they are different.
Okay, that's awesome. Thank you. We've got a couple of questions in the Q&A section. If you would like to ask James a question yourself, please do stick your hand up. It's always lovely to see people and hear questions live, to know that, everybody's out there and still listening. We've got 81 people on the call, so somebody must be brave enough to ask a question. Just while you're plucking up the courage, I'll ask the questions that are in the Q&A. So Anne Hamilton, she's asked the question pragmatically, will the slides be available afterwards?
Yes.
Yes, we said we'd share those. And is there a reference list regarding the research that's been shared for further reading?
Oh, that's a good question. So what I've got, Anne, is so the short answer is no, not really. But the longer answer is, in order to do this, and I've been doing this for a few years now, every time I get a bit of evidence, I stick it into one great big slide deck, which does tend to have reference points on. So I can, if you're interested, I can share it. There's nothing, I don't think, contentious in there. It's just not super readable, but it does have the links to those references. I probably wouldn't want to share it with everyone, but if you're particularly interested in following up those references, then if you can let us know somehow, maybe through you, Joe, then I'll send on that wider slide deck. It's probably got about 100 slides in it.
Absolutely. Okay, that's great. Thank you. So the next question we've got is from Elaine McClure, who is saying, is there an NHS Scotland Digital Academy and or resources stroke training, etc., that you're aware of?
There is. In a second, I might try and find the link for that as well. So it's led by a lady called Leslie Holdstock, I think. We do talk regularly, and I think over time we'll start using one another's resources because we're all taxpayer funded. So there's also one in Wales, less so in Northern Ireland, and certainly the four UK nations are very keen to collaborate more on these sorts of things.
That's great. And Tina is hot on the task. She's already put the link in to answer the question. So if you're looking in the Q&A section, Elaine, the answer's underneath your question and the link's there.
Thank you, Tina.
Yeah, Tina, if you want to put it in the general chat, others will be able to see them as well then, in case others are also interested in those other country links. If you can drop those in, that would be fantastic. I actually had a question, and it was in relation to the comment you made about 1 in 5 members of the health and care not having the computer skills to necessarily be able to access the online learning that many of us produce.
Yeah.
And I just wondered whether or not you had a view or any information around whether or not people would be able to access learning via YouTube, given that even if they don't have computer skills, they might have phone skills and therefore might be able to access YouTube for learning. And is that an alternative option?
So possibly. So firstly, the stat, it's 1 in 20 or 5%. So it's not quite as bad as 1 in 5, but it's I guess the point is there are always going to be some people who don't necessarily have the skills to access what you're trying to share, and therefore deeply understanding your audience and understanding what the constraints they're under is super important when you're designing any sort of information to underpin a change program. What we find, so the hypothesis that you're sharing, Joe, is that maybe more people are able to access something like YouTube to access training, which sounds fair, but there are likely to be some people who either don't have access to a phone or just haven't developed those skills somehow. We know, for instance, that people who've been out of work for a significant period of time tend to rely on computers and even phones less, believe it or not, and it actually reinforces things like social exclusion. And if those digital skills are not used regularly, they kind of fade quite quickly. We know that digital exclusion is quite a big issue. DSIT produced their Digital Inclusion Action Plan earlier this year. That's the Department for Science, Industry and Trade. I'm very proud to say the NHS Digital Academy was mentioned specifically as a source of expertise in this area. But what I would say is I wouldn't make the assumption that YouTube, because it's easier, will reach everyone. In fact, a lot of people are saying to us the things that they need to know are not the things we think they need to know. So we've been looking more into things like digital champions initiatives and train the trainer initiatives so that we can support sort of what's been known as the at the elbow learning. So I've got a problem right now. Who do I talk about this issue right now in front of me? I don't want to go on a course. I just want to know how to do the thing.
Yeah.
And having that sort of support appears to be, that feels like a very promising avenue to explore for us.
Well, in that case, Sarah Javid has asked exactly the right question. Are you looking for digital champions per directorate stroke programme who could help cascade learning and signposting?
Right. Okay. So per directorate I can't see this question.
So it's in the Q&A. Sarah's from NHS England, but I expect that it would apply to trusts and other NHS organisations as well. Is there a digital champions network?
So there may well be one. So what we have seen is there are a number of organisations that set their own digital champions networks, that they vary in terms of their definition of what digital champions are and what they're trying to achieve. There is a digital champions toolkit that's available that we'll be doing a refresh of. So if you just maybe Tina can find that as well. That'd be awesome. Thank you, Tina. But it does have quite a good background on what's been done before with some examples of different models in place. Some organisations volunteer people, some ask for volunteers, some test or assess expertise, some support with additional training. There's digital champions, some do none of that and do their own thing. So there's a huge amount of variety at the moment. I think one of the things that we're going to try and do is bring a level of consistency to how these things are likely to be taken forward, and what the benefits and pros and cons are to those different models. But what does seem to be true is that digital champions models are organization specific. So they do require leadership buy-in. They do require people to be released to support others to learn. They do require an element of infrastructure and resourcing. So it's not going to be something that can be exclusively led nationally. And one of the things we're doing is we've been running a digital data confidence and competence special interest group. More than 700 people across the NHS have signed up to it. And these are people who are really passionate about supporting the digital skills development in their own organisation. So they're helping us develop those products and services. Anyone who's interested is welcome to join.
Okay, if you stick the link in the chat to that as well, if you're interested,
yeah, I can find that one.
Let's give Tia another challenge. Sarah asked another question in the chat, and it was about the digital skills development networks. Now they show up as regionally, and what she's asked is there one of those for the central team?
As in NHS England?
Yeah, I think that's what she's referring to in terms of national organisations.
No, but everyone who works in the central team works in a geography. So the digital skills development networks are open to anyone who works in the NHS within those areas. And so, for instance, I work for the national team in NHS England, but I live and work in London, and London DSDN is my local DSDN, Digital Skills Development Network. I go along to their conference. I would avail myself of their learning if I felt it was appropriate. So do that.
Yeah, there you go. So join your local one. That's great. We've got a comment from Sharon Mirando saying, we tried the digital champions approach and was well received, but didn't address skills development. Don't know if you, Sharon, are you there? Did you want to elaborate on that? And was it because it wasn't intended to do skills development, or was it just support, or it didn't work as planned?
Sorry. Yeah, it was more to champion digital skills. And we did a lot of masterclasses. We had some great speakers, but it was more directed towards like VSMs. And I felt it didn't really achieve the development of digital skills. I personally felt it didn't achieve that. And obviously it had some positive points, but it's kind of fell a bit quiet. It's gone a bit quiet now. It's not really being talked about, so that was kind of the issue.
Yeah, I think it's a typical thing that these initiatives started off, but they require constant effort, don't they, to keep the momentum going. But I think there's a good point there, that being clear about what the role of the digital champions is and what you're asking them to do. Is there something that you've got, James, that articulates the role of the digital champion, or where organisations could use that as, a template for developing in their own organisation?
So the toolkit that exists does do that. We think it does need a refresh. So that's what will happen over the next 6 to 12 months, I'd have thought. But in there is a definition of digital champions and a description of the different models. There's also a selection on outcomes and measures. And there are 8 specific measures that are mentioned there. I think it gives me the opportunity, this question, to say there's probably more that is absolutely core change management capability here around digital change than we might necessarily immediately think. Any change, doesn't matter whether it's digital or not, you need to be clear about what your outcome is and what you're measuring, and we're just not that great at that much of the time. This is where we need the skills that the HPCA is bringing about, Jo.
Absolutely. Happy to have a chat about how we can put some of the change management capabilities and make it accessible to the digital folks to develop that. We're just about out of time, and I know some people have got to jump off to go to other sessions. Unless we've got any last questions, I'll just do a very quick last look at the Q&A. I think that's it. But that's been fantastic. Thank you so much, James.
It's my pleasure. Really enjoyed it.
Really great insights. And Tina and ourselves, I think we've managed to keep up with all of the references and make sure everybody's got those. We will send those out to everybody. We'll send a copy of James's slides along with a link to the actual recording as well. and the links to the references that we've mentioned throughout the session. So thank you everybody for joining us for that, and thank you James again. That was a fantastic session, really great insights, and as things develop, maybe you can come back and tell us about new things that get launched and anything that gets engagement from people from the community.
That would be my absolute pleasure. Thank you ever so much.
Thank you all. Have a great rest of the day. Take care. See you again
Bye-bye.
soon. Bye.
You.